Well, we have Dr. Shaleen Sharma and he's practicing in Meerut, Uttar Pradesh. Well, we'll be talking about OAB because it's a very important and very problematic situation for all the patients out there. So if in case you want to know anything about OAB, this is the right platform. Very welcome.
Thank you.
So, first and foremost thing is, can you please describe for the audience viewing this, what is an OAB and how this impacts a social life of a patient?
Yeah, as the name suggests, OAB means overactive bladder. So that means your bladder has become more active. So what's the role of the bladder is to store urine so that we find a comfortable time and place to void. And we should be able to suppress the desire to urinate, to a comfortable time. Overactive bladder means the bladder has become more active now. It tells your mind to evacuate the bladder. I mean, the desire to evacuate the bladder or the desire to pass urine becomes very frequent in OAB. So the patients with OAB or overactive bladder, they tend to pass urine a number of times during the day, and sometimes it is even every 5 minutes or 10 minutes. And similarly in the night also, which disturbs seriously their quality of life.
Well, why it becomes very important for the diagnosis to be done as soon as possible for an OAB patient?
Yeah, actually the diagnosis of OAB is by exclusion.
Yeah.
That is, if you don't find any other disease, then the diagnosis of OAB is made. So other common diseases which can mimic OAB are UTI, the very common urinary tract infections, tuberculosis, stones, and some spinal problems. So it's important to first of all to diagnose those diseases and then diagnose OAB by exclusion. And since this is a disease which is not taken seriously and which impacts the quality of life of a person in a very drastic way, it is important to diagnose OAB.
Well, I have heard the term called behavioral therapy. So, would love if you could tell the viewers what is the behavioral therapy and how it works.
Yeah, the behavioral therapy is the first line of treatment which we start once we diagnose a patient of OAB. And in behavioral therapy, there are little modifications in your behavior which can improve your condition. Like the first and the foremost is that the patients of OAB should restrict their fluid intake.
Okay.
Like the water should be not more than 400-500 ml. I mean, whatever the minimum amount is required to quench your thirst, and that would depend on the environment in which you are living. If you are in a hot and humid, then maybe you require at least 800 ml to a liter of water. And if you are living in a colder place or during the winters, maybe you could do with 300-400 ml. So you have to restrict the quantity of water you take. Then you have to absolutely curtail the amount of extra fluids which you take, like coffee, tea, or cold drinks, sodas, and smoothies, and
There wasn't anything.
Yeah, any liquid which is not required by your body. So I here mean that maybe you should only have milk and maybe a glass or half a glass of juice for patients of OAB. Tea, coffee, cold drinks, soda, shakes, alcohol, beer, they are a big no for patients of OAB. And then after restricting the fluid intake, the next thing in behavioral therapy is that sometimes or quite often the overactive bladder is associated with the type A personalities. These people are very anxious and that tends to worsen their OAB. If you have a disease and if that disease does not impact you in a big way, maybe you can handle that better. But these patients are already the type A personalities. They are very anxious. So they tend
to get psychological factor which is
there is a significant component of a psychological factor to start with, or the psychological factor comes in once a person has a disease and they suffer from it. So it's difficult to tell that which comes first. So second is the maybe you should start meditation or the breathing or calming exercises, or whatever just calms your mind. Then behavioral therapy is then timed voiding, that we tell these patients to because sometimes these patients tend to void more frequently in the day and not in the night. So that means that once they sleep, once their conscious brain is not active, they are able to suppress the desire. So they can maybe go for timed voiding, that you set up an alarm or a time by watch that you have to go every 1 hour or half an hour. Now if you are going every 10 minutes, you try to increase that to 25 minutes, make a voluntary effort, compulsive effort. No, I'll not go unless and until the person starts leaking. It's a different story. But if you don't leak, then wait make it half an hour to start with, make it 1 hour, make it an hour and a half and 2 hours, and so on and so forth. And then there are in the behavioral therapy, there are some pelvic floor relaxation exercises. You could just log on to the YouTube, type exercises for overactive bladder or Kegel exercises for pelvic floor relaxation. Kegel is Kegel. And you can just find exercises which are easy and convenient for you to do, and prior to that just make sure that you don't have a problem in your back or spine, which is.
Well, can you please share any success story wherein by incorporating the behavioral therapy in a treatment, the patient got relaxation and of course the success?
Yes, there have been a number of patients, and I remember a young female. She was, I think, about 21, 22 years of age, and she had this problem that she could not do anything at all. I mean, not go to the office, could not work, could not do the household chores and like that. And she was going every 5 and 10 minutes. It started with 1 hour, but the psychological impact was like that she started going every 5 to 10 minutes. And we just put her on the lifestyle modifications. She restricted her fluid and pelvic floor relaxation exercises, and then timed voiding, and the time increased to half an hour to 1 hour, and only with the help of the behavioral therapy and simple lifestyle modifications she was able to increase the time to say about 2.5 hours like that. And
now she is back on track?
Back on track. And then of course the dietary modifications, they're very important. People actually can identify that if I have this kind of, if I eat sambar, I have a problem. If I eat spicy food or say some gravies thick with masalas and all, they are actually able to identify that this is what is causing problems, to try to avoid that.
Thank you so much, sir. It was amazing having you as in board with us. Thank you so much for being here. It was indeed a very, very informative session. Thank you.
Thank you.